Tonight we're going to do a skin, nail, and a hair assessment. First, I'm going to do a room scan. Oops, excuse the mess. Okay, and the floor here. Okay, Mr. Montagna, I will ask you a few questions about your health history. Do you know of any skin diseases that you may have, like allergies, hives, acne?
No.
No, okay. Do you have any like excessive bruising in any area of your body?
No.
Okay. When you go out in the beach, do you put sunblock?
Sometimes.
Okay. All right. Well, first I will check your skin, the color of your skin. If there is cyanosis, bluish, or redness, pale or pallor, and jaundice. Looks like you're just appropriate for your ethnicity, and it's just normal for your ethnicity, so it's okay. And I'll check now the temperature using the back of my hands. Check the temperature here. It's warm and dry, and then I'm checking now for the texture and thickness. I'm gonna pinch your skin a little bit. Okay, that's checking for turgor and mobility, so that it's going back to its original position. And any edema, any vascularity or bruising, and then um, no edema, checking for any lesions. I can see a few maculae, flat freckles here. Yeah, here. Freckles. See freckles. That's maculae. Numerous maculae with less than 1 millimeter. Can you please show us your back? I don't see any skin here. Here I can see there's a few like freckles here too, numerous maculae, and I can see an elevation here, and when I touch it it's a little hard. And then does that hurt? No. Okay, so it's elevated, it's round, and the shape is round. The size is about like about 3 millimeters, and then the color is is red, and then yeah, there it's round, and the location is on the upper right back of his body. So it looks to me like it's a cyst. Do you know, Mr. Montagna, about the about that cyst on your back?
Yeah.
Has it been diagnosed?
Yes.
What? So is it like cancerous or no? Because I don't see any exudates there.
No, it's not cancerous.
Okay, so that's good to know. Okay, so now I will proceed with your hair. First, I will check your the thickness of your hair, the texture. It's thick. I'll see for the distribution. There is some type of like male pattern baldness here on the frontal lobe, male pattern baldness, and then here the color is a mixture of black and gray, and I have to check if there are any infestations here. Nothing. Okay, so now I will proceed with the nails. Okay, so check for the nails. There, I am checking now for the shape. It's round, the color is pink, and the nail plate is translucent, and then the nail bed is pink, and then you okay?
Yeah.
And then the consistency, I can see it's smooth. It's uniform in thickness. I need to use both hands, and then it's the nail plate and the nail base are firm to palpation. And then the profile sign is less than 160 millimeters. And then let's see your capillary refill. 1, 2. Okay, so it's about 2 seconds. Now I will proceed with your toes, okay?
The toes?
Yeah, can you put your feet straight so we can assess your toes? So I'm gonna have to move my camera here. So that's his toes. And I'm checking now the shape of his toes, of his toenails. It's round, and then the color is pink. He has some of his toenails have some leukokinia striata, which is normal, and the consistency is uniform and smooth. It's firm to palpation, and the profile sign is less than 160 millimeters there. Okay, so thank you, Mr. Montagna. Now before we end our assessment, I will before we end our assessment, I will teach you some self-promotion, self-health promotion. Like, I will I will teach you how to do a self-assessment with your skin, like with your skin. If there's a mole or cyst that you can assess on your own. So using the ABCDE rule. So A stands for asymmetry. So if it's not a regular shape, or it just doesn't look the same, then that calls for attention. And B stands for border. So if there's like a poorly defined margin on the edges. And C stands for colors. So if there's a mole and there are different colors, like there is brown, pink, red, blue, or tan, and tan in one mole. So the various colors in one mole, then that calls for attention. D stands for diameter, means that if it's greater than 6 millimeters, or like the size of a pencil eraser, if it's more than that, then that calls for attention. E stands for elevation, evolution, or any enlargements. And additional signs or symptoms would be like if there is a rapidly changing lesions, like a new pigmented levi, or if there is like a sudden appearance of itching, burning, or a bleeding mole, okay, then that calls for a referral. So that ends our skin, nail, and hair assessment for my patient. Thank you.